Hundreds of women across the United Kingdom are now contemplating legal action. This fear centers on a widely used contraceptive injection known as Depo-Provera. These women are worried that the jab has exposed them to an increased risk of developing meningioma, a specific type of brain tumor. While often non-cancerous, these growths can still pose serious health threats by exerting pressure on the brain and delicate nerves. The implications are significant, stirring unease among users and medical professionals alike. Similar concerns are echoing in the United States, where many women have already initiated legal proceedings. They allege that the manufacturers were aware of the potential dangers, but failed to provide adequate warnings. This growing disquiet highlights a critical issue in women's healthcare. It questions the balance between contraceptive convenience and long-term health risks. Did women receive all necessary information to make a truly informed choice about their bodies and their health when opting for this long-acting contraceptive method? Depo-Provera has been a common contraceptive option for many years, often chosen for its convenience, requiring an injection only every few months. However, recent findings and the voices of affected women are painting a more complex picture. The potential link to meningiomas, tumors arising from the membranes covering the brain and spinal cord, is a serious concern. These tumors, though typically benign, can lead to severe complications depending on their size and location. The very possibility of such a risk associated with a routine contraceptive is understandably causing widespread alarm and prompting urgent calls for greater transparency and investigation. The current wave of concern underscores a broader need for ongoing scrutiny of medical products, even those long established. For the many women who have used Depo-Provera, the recent revelations are deeply troubling. Hundreds of women across the United Kingdom are now contemplating legal action. This fear centers on a widely used contraceptive injection known as Depo-Provera. These women are worried that the jab has exposed them to an increased risk of developing meningioma, a specific type of brain tumor. While often non-cancerous, these growths can still pose serious health threats by exerting pressure on the brain and delicate nerves. The implications are significant, stirring unease among users and medical professionals alike. Similar concerns are echoing in the United States, where many women have already initiated legal proceedings. They allege that the manufacturers were aware of the potential dangers, but failed to provide adequate warnings. This growing disquiet highlights a critical issue in women's healthcare. It questions the balance between contraceptive convenience and long-term health risks. A significant study published in 2024 has raised alarms. This research appeared in the British Medical Journal. Women using Depo-Provera for over a year were 5 times more likely to develop a meningioma. This stark increase in risk is concerning. Conducted by France's National Agency for Medicines, the study analyzed over 18,000 women. The findings suggest a potential causal link that warrants further investigation. In response to the growing body of evidence, regulatory authorities have begun to take action. In October 2024, the UK's Medicines and Healthcare Products Regulatory Authority, or MHRA, made a significant move. They called upon Pfizer, the manufacturer of Depo-Provera, to update the patient information leaflets. Specifically, they mandated the inclusion of a clear warning about the potential risk of meningioma associated with the contraceptive jab. Pfizer, the pharmaceutical company behind Depo-Provera, also took action around the same time. In October 2024, the company issued a communication directly to NHS doctors. The letter advised medical practitioners to immediately stop prescribing Depo-Provera to any woman diagnosed with a meningioma. This guidance aimed to prevent further exposure in individuals already affected by this type of tumor. The MHRA's intervention and Pfizer's subsequent communication represent an official acknowledgement of the potential danger. The requirement for updated patient information leaflets is vital. It ensures that women considering this contraceptive, or those already using it, are made aware of this specific potential risk. These regulatory actions, while important, are often the first step in a longer process of understanding and mitigating drug-related risks. Beyond the statistics and regulatory statements, the personal accounts of affected individuals bring the issue into sharp focus. Jessica Blake, an 18-year-old, shared a harrowing experience. She She began taking the Depo-Provera injection in January 2024. Her gynecologist had advised it as a way to avoid having her period. Since then, Miss Blake reported suffering approximately 20 seizures. This was a terrifying development for a young woman with no prior history of such medical conditions. Her most recent seizure was so severe that it resulted in her needing emergency resuscitation. While no doctor has definitively linked Jessica Blake's seizures directly to the Depo-Provera injection, she herself believes there is a strong connection. The timing of the onset of her seizures, following the administration of the contraceptive jab, fuels her conviction. Her story highlights the potential for severe adverse reactions that may not yet be fully understood or widely recognized by all medical practitioners. Dr. Ann Henderson, a consultant gynecologist with extensive NHS experience, commented on cases like Miss Blake's. She acknowledged that while seizures are considered very rare side effects of hormonal treatments like Depo-Provera, they are indeed possible. Jessica Blake's story is a stark reminder that medical interventions can have profound and sometimes unforeseen impacts on individuals. Her youth and the severity of her symptoms make her account particularly poignant. Section 5. Medical professionals speak out questioning long-term use. The growing concerns surrounding Depo-Provera have prompted some medical professionals to voice strong opinions. Dr. Ann Henderson, a consultant gynecologist with 17 years of experience within the NHS, has been particularly outspoken. She described the practice of prescribing medroxyprogesterone, the active ingredient in Depo-Provera, merely for period control as absolutely shocking. She went further, stating that such prescribing practices could be verging on medical negligence. Dr. Henderson elaborated on the physiological impact of steroid hormones like norethisterone and medroxyprogesterone. She emphasized that these powerful substances can affect virtually every part of the human body. Their influence extends to the brain and the central nervous system. Crucially, she pointed out that these hormones were never originally designed or intended for the long-term management of period-related problems. The broader implications of using potent steroid hormones for convenience or lifestyle reasons are now under intense scrutiny. Dr. Henderson's comments suggest a potential disconnect between the original intended use of such medications and their current application in some clinical settings. The perspective offered by Dr. Henderson and other concerned medical professionals calls for a re-evaluation of prescribing guidelines. Section 6. The legal battlefield, women seek accountability. The concerns over Depo-Provera and its potential link to meningiomas have now moved into the legal arena. In the United States, a significant class action lawsuit is underway. Approximately 400 women have joined forces to sue Pfizer, the primary manufacturer of Depo-Provera, as well as other companies that produce generic versions of the medroxyprogesterone acetate injection. All these women share a common distressing experience. They developed meningiomas after using the contraceptive jab for at least 1 year. Their lawsuit alleges that these pharmaceutical firms were aware of the link but failed to adequately warn users. The legal action in the U.S. aims to hold these companies accountable for the harm allegedly caused. Virginia Buchanan, a lawyer from the U.S. law firm Levin Papantonio, which is involved in the case, expressed her determination. She stated, "This will bring us closer to achieving justice for women who have never been warned about the increased risk of developing a brain tumor." Across the Atlantic, women in the United Kingdom are also exploring their legal options. Section 7. Understanding the scale Depo-Provera's prevalence and tumor traits. To fully grasp the potential impact of these emerging risks, it is important to understand how widely Depo-Provera is used. According to NHS data, approximately 10,000 prescriptions for medroxyprogesterone acetate, the generic name for Depo-Provera, are dispensed each month in England alone. This figure highlights the significant number of women who may be, or have been, exposed to the drug. When multiplied over years, the total number of users is substantial. Each of these individuals relies on the healthcare system and manufacturers to provide safe and effective medical options with clear information about any associated dangers. It is also crucial to reiterate the nature of meningiomas. As previously mentioned, these are tumors arising from the meninges, the protective membranes surrounding the brain and spinal cord. The majority of meningiomas are non-cancerous, meaning they do not typically invade surrounding tissues or spread to other parts of the body like malignant tumors do. They often grow slowly, sometimes over many years, without causing noticeable symptoms initially. Section 8. Navigating choices. Advice for current and future users. Given the recent findings and regulatory actions, women currently using Depo-Provera or considering it as a contraceptive option face important decisions. The first and most crucial step is to consult with a healthcare provider. This discussion should be comprehensive, covering the individual's medical history, the duration of Depo-Provera use, and any concerns they may have regarding the meningioma risk. It is essential for women to feel empowered to ask direct questions about the benefits and risks, including this newly highlighted potential danger, before making any decisions about starting or continuing the jab. For women who have been using Depo-Provera for more than a year, the French study's findings are particularly relevant. They should discuss the 5-fold increased risk of meningioma with their doctor. It may be prudent to explore alternative contraceptive methods that do not carry this specific risk. There are many other forms of contraception available, each with its own profile of benefits and side effects. A healthcare professional can help navigate these options and find a suitable alternative based on individual health needs and preferences. Section 9. A call for vigilance, prioritizing patient safety and informed consent. The unfolding situation regarding Depo-Provera and the potential risk of meningiomas serves as a critical reminder. It highlights the paramount importance of patient safety and truly informed consent in all medical interventions. Women have a right to know about all potential risks associated with any medication they are prescribed, especially one intended for long-term use. The information provided must be clear, comprehensive, and up-to-date, reflecting the latest scientific understanding. Anything less undermines the trust between patients and the healthcare system. The experiences of women like Jessica